Alberta's Health Minister Sarah Hoffman says the bad Alberta economy means there is just no more money for drug treatment beds to help combat the deadly fentanyl crisis gripping Alberta. She says her hands are tied. For background, the deadly opioid street drug has poured into Alberta over the last 5 years in both its pure form or as an additive in other street drugs. It's in the same family as morphine, but it is 50 to 100 times more toxic. You can't see it, you can't smell it, and many drug users don't know they're taking it until it's too late. Now, this lack of additional funding for drug treatment beds has been compounded by the fact that the NDP Health Ministry cut $13 million from their 5-year capital spending plan for drug treatment beds in November. Now, think about it. The NDP cut funding for drug treatment back during a time when the number of deaths by fentanyl had grown to 274 people. That's an increase of 230% over the year before. In 2011, there were only 6 deaths province-wide caused by fentanyl. That's how fast fentanyl is sweeping the province. And yet, in November 2015, when the NDP cut the funding for drug treatment beds, Health Minister Sarah Hoffman was obviously well aware the province was in the middle of a fentanyl catastrophe. But the NDP made the cuts anyways. They cut treatment bed spaces to save money, while simultaneously hiring nearly 50,000 more government workers, because street junkies don't pay union dues. Now, in the face of these renewed calls for more drug treatment funding, Hoffman told the Calgary Herald, and I quote, "I have a deficit and the price of oil is a fraction of what we're used to seeing it at. We are continuing to invest in resources in that area, but of course, we'd like to provide far greater than we are today." Wow. Suddenly, Hoffman is a fiscal hawk with her watchful eye on the bottom line over at Alberta Health. I might actually appreciate that sentiment if it were true. Sarah Hoffman found $200 million in the healthcare budget to upgrade the government-run, that means union-run, hospital laundromats rather than move the laundry service to an outside, cheaper, and more efficient privately run contract. Hoffman isn't a fiscal hawk, she's a union hawk. She can find money to keep the hospital laundromats unionized and inefficiently government-run while not finding a loose penny for drug treatment. Those are Sarah Hoffman's healthcare priorities. There is money not to outsource the union-washed bed sheets, but there is no money for actual beds when this year's number of fentanyl deaths is set to overtake last year's record high. Rachel Notley herself used to criticize the PCs for failing to prioritize healthcare. Remember when Rachel Notley said this when she was in opposition?
The PCs have failed to manage Alberta's healthcare system in the good times. They've failed to invest in crumbling hospitals. They failed to provide services. They couldn't even fix an elevator, for crying out loud. Now that the price of oil has dropped, now that budgets are tighter, does the Premier really expect Albertans to trust him to fix healthcare now?
Well, people are dying, and the NDP can only find money to keep the unionized fluff and folders in the hospital laundromat at work. Some people actually believe the NDP might be good at healthcare and committed to quality care. But the NDP aren't good at healthcare, they're good at healthcare unions. The healthcare is just a side gig. They don't really seem to care about it at all. Police in Calgary are overburdened with a spike in property crime because they are directly attributing the spike to fentanyl. The fentanyl crisis is about more than just the addicts and their families. It's making all of our communities less safe. Now look, I get it. Doing drugs is a choice. People choose to do drugs. They choose the destruction they bring to themselves and to their families and to their communities. I understand it. Believe me, I do. But surely it is in society's best interest to help these people get off drugs when they choose to get sober, get back in the game, and become productive, tax-paying people again. And it is a far better way to spend public money than building supervised injection sites to help them do more drugs more safely. And I'm not sure it's very comforting to the families of drug addicts that have to wait a minimum of 20 days to get them into treatment that the sheets are washed by a government worker when their loved one lands up in the emergency room on another fentanyl overdose. The NDP say they care about the least of us, and us conservatives like me are heartless and greedy. Rachel Notley says she cares about the poor and we should all be helping each other. But street junkies don't pay union dues. For the Rebel.media, I'm Sheila Gunn-Reid.
Thanks for watching. Click here to never miss a Rebel update. Want even more of the Rebel? Well, click here to become a premium member.